I know someone who went to the Jewish this week and they turned them away and said, come back the next day. It seems incredible to me that this far into the pandemic, it's still hard to get tested. And you said it's worse in the East. I've heard a lot of problems, particularly at the Jewish. 3 hour, 4 hour lineups, professors from McGill tweeting to say it's outrageous because they do, they're getting tested all the time because they're professors. They want to make sure they've got little kids. I'm wondering what we're really doing to improve that, and why it seems such a problem at this point in the pandemic. It just seems very surprising.
But of course, the opening of school always give an influence of a population who wants to get their test. We have specific indications for tests. Of course, we want people who have been in contact or linked to an outbreak, or when they have symptoms. So of course we're not testing in a preventive manner. So I hope people that are going to get their tests, it's because public health have asked so, or because they have symptoms. Uh, we're going to open new modalities to and the capacity. At the same time, we have a maximum capacity in the laboratories also that we have to manage with. And we're going to look at maybe increasing capacity with other kind of tests, but we have to talk with the instance that are testing to make sure we have this capacity. At the time we're speaking, we have at the opening we saw that we have delay, but we're working on it, and I hope next week, even in the next couple of
But I'm
days,
not
we
really hearing concretely what would happen to get rid of these delays.
but we're gonna some have open proximity centers in CLSC, in some CEUs. We're gonna open more sans rendezvous. We're going to give. We had all those symptoms when we had. Voyons, sans rendez-vous en anglais, c'est
Without appointments.
without appointment clinics. We have some systems that if we have delay, we give a tickets and people can come back at a specific hour. So it's more convenient when you have small children. And we're looking at other, with the rapid tests, for example, other ways that we can increase capacity and use them in specific setting when there's outbreaks or with symptomatic patients. So we're going to look at all those modalities to make sure we can increase our capacity. At the same time, as I was saying, we have a maximum capacity in laboratories that is linked with the technical resources.
Okay, so we're at that maximum.
No, we're not. We still have a couple of thousand left each day that we can maximize.
For the Swiss Centre-Ouest, there are two clinics, one in the parking of the hospital, Jewish
Jewish,
hospital, and the other one is on CLSC Parc Extension, and the both are open for the Jewish from 8 o'clock in the morning until 2020.
No, I know the
Yeah.
hours, but I mean, do you think it's reasonable that you have to wait 3 hours in September
Yeah.
2021?
It is not.
Okay.
It is not reasonable, but we're working on it, and we know the strategy has been tested. I think we have an increase at the beginning, and it's often the same teams that are mobilized in vaccination and in screening. So we're working to put the system in place and make sure that we can increase capacity. What I would say is that we're working on it, and we're really conscious that we do not want to make the population wait too long.